traveled to India and worked with Mother Teresa, and she made the statement that probably changed my life more than anything, when she said, "Look in your own backyard. What can you do there?"
I've had health issues all my life. Was actually brought home to die in 3 days, but I'm still here. And I was thrilled to find out that there was a place where you can go, and the only requirement is that you don't have health insurance.
I was in construction work, and that's when I started having headaches. And then is when I come to see Marian, and then she checked me, and that's when she found out that I have a brain cancer.
If they weren't here, I might not even be alive.
You know, when I drew it out on a paper napkin from a hotel room, really, that's where the first iteration of the community care clinic happened. When we started, it was like 3 hours one night a week, and that was exciting in itself. That was really exciting.
And the need was so great that we filled a void, but nobody was seeing continuity of care week after week of diabetics, hypertensive, COPD, arthritics, people with really bad medical problems.
It's amazing because we started out in this same building. We had a few rooms. The lab was a small exam room. I saw a man, he was probably, I think maybe in his 50s, very, very nice man, but he had come up here. He had built his own house with his own hands, lived in it, raised his children. He had a heart attack, and the medical bills were so great that he lost his house. And it really struck me, how can someone lose their house in this country because they got sick?
The health needs that are being met here are the needs of people who have very often gone without health care for a long period of time. Almost all of our patients have at least one, and usually multiple, chronic illnesses going on.
I know people who have had heart attacks that have come through and been found, people with brain tumors, diabetes.
And we have, 6 specialties, and we really like how we have mental health and everything else all integrated together for our patients.
I am of the belief system that the mind and the body are very connected. And anxiety or depression or a mood disorder is definitely a big factor in these individuals' lives. They can get them right in to see me right away. I have someone in my office who is on a new medication, or needs a different medication, or the medication changes are not going well. I can go down the hall and grab a medical provider, and we can take care of it at that time. And that is such an awesome feature of the clinic.
We offer a fun and fitness class twice a week, and we do diabetes education, hypertension education, management, case management services.
They do a lot of our blood work. When the cardiologist needs some extra stuff done, instead of us having to fork it out of our pocket, which we did not have and don't, it has helped us so much for them to do that for us. I have my mammograms every year. They help me with that. I would probably not have it done if it was not for them.
the feeling of just being in here, there is a feeling where people really care about the patients. It is not about billing, it is not about making money, it is about giving them the best care possible.
All the doctors and the staff here that we have worked with, they sit and listen to you, whether it's 5 minutes, 10 minutes, or 20. And it has made a difference in our life.
I'm a diabetic, and we've been through the diabetic classes on the proper way of eating and dieting and stuff.
Since we've been involved here at the community center here, I've received better health care than I've had most of my life, because they just have great people here who care about what goes on in your life and your health, and do a fine job.
This is certainly not work that we do in isolation. It's work that we do by having help from a variety of people and a variety of organizations, including LabCorp and Watauga Medical Center.
Volunteers are very important, definitely, because we're such a small clinic, but I think now we definitely have over 1,000 patients, and there's only, I think, 8 staff. A few of us are part-time, a few of us are full-time. We definitely depend on our volunteers hugely.
Securing funding for nonprofits has been a challenge for many, many years now, so there's nothing really new with that.
There's so many times that we would love to be able to do more for our patients. Example, we have a program, as funding is available, we can send our patients for dental appointments or vision appointment. Sometimes the funding's not there by the end of the year, and patients aren't able to go for that. And it's hard, to have to tell that patient, no, we can't send you for those services.
Right now, the most precarious feeling that we have around here is just being able to stay open at the level at which we're open now. We understand that we could cut back, but if we cut back, we can't do as much for our patients as we want to.
It's pretty simple in that people that would not have access to health care now have access to health care, and seeing how badly some of these patients need to see these providers and how often they need these providers, I can't imagine the community without it, without this resource.
But I have never seen anyone that I felt that did not fully need all the efforts of everybody working for them on the clinic.
I feel like if people could understand how the clinic serves those that do not have medical insurance, cannot afford medical insurance or health care, if they could see how much this clinic helps people, I think they would be more willing to participate, whether their time or their money.
There's a lot of misconception about Medicaid.
That everyone is going to have health insurance as a result of the Affordable Care Act. Each year, the federal government determines what level of income you can have in order to be designated as someone who is living in poverty.
In the state of North Carolina, not having taken the Medicaid expansion, people who live at or below 100% of the federal poverty level have no access to care.
This is the kind of nonprofit that impacts everyone in the community, whether you have health insurance or not. Maybe it's your employees that are uninsured. Coming here for care is going to keep absenteeism down, keeping folks out of the emergency room for non-emergent care, keeping folks out of significant hospitalization stays because they've been able to get the treatment they need here before it gets that serious. So we really look to the community to help us and partner with us in making sure that everybody has access to health care, as they should. That's one of the things that's the foundation of this clinic.
Since they've opened the free clinic, then I know that I can come here and I can get medications and I can get counseling and I can get what I need to sustain a better quality of life.
It doesn't matter if you are black, white, green, purple, they take care of you. And it's really, really wonderful to have this clinic right here. And I hope they continue doing the work they're doing because it's wonderful.
I really like it here. I really feel I'm being cared for here.
I've seen the clinic go through so many changes, so many improvements.
I never thought that we'd be treating as many people and be open as many hours and have as many providers and as many specialties, and all under one roof and actually just be taking care of people just so well.
You would think that at some point we would reach a peak where, okay, we're doing all we can. We're always going to the next level.